demonstrate how to perform chest expansion. You first ask the patient to take a deep breath in, and then exhale all the way out and hold it. And then you tightly grab the chest and keep the fingers lifted off the chest, and then ask the patient to take a deep breath in and out.
Okay, this is a tutorial on how to auscultate the back posterior side of the chest wall. So Ben, if you could take this for a second and then hug it against you. And now let's have a quick description of the anatomy. If you could pinch both of your scapulas for me, that'd be great. So that's the trapezius muscle right there. That's your latissimus dorsi, and that's his scapular border right there. So together, these form the edges of the auscultation triangle, which will be one of our marker points on both sides. So we start up there, in the triangle, down there, and one at the bottom for assessing bilateral crackles, if existent. Okay, let's go, Ben. Now you can hug the pillow again. And so whenever I touch this on your skin, you take a deep breath in, and then out with your mouth, okay? Go. That's good. Thank you very much. Okay, this is a demonstration to do rib counting. So to begin with, we should palpate the apex beat. So first start off in the axilla, then slowly come closer and closer till you feel the apex beat. Once you do, then you need to find the rib. And so to do that, find the jugular notch, walk down it. There should be a divot that would be indicative of angle of Louis. Around the angle of Louis, you would have the second intercostal space. Then you have the next third rib that you need to find. Then the fourth rib, then the fifth rib, and then walk down the fifth rib, and you should be in the fifth intercostal space. Then you draw a line in the mid-clavicular line, and that should be your approximate position of an undisplaced apex beat. And now this is the tutorial on how to do percussions. So first of all, you have to sit your middle finger in the middle of the intercostal space, right there, and then impact it really hard so that you have a strong foundation. Then you're using middle finger on the middle part over here. Twice. Okay, now we'll go through examining the lymph nodes of the neck. Alright, to begin with, we need to orient ourselves with the anatomy of the body. Here you can see outlined is the trapezius. Here you can see the two heads of the sternocleidomastoid, right there, attaching to the mastoid process. Yeah. And so the red dots indicate the lymph nodes that we'll go through. So to start with, here you can see here is your sublingual lymph nodes, which are at the edge, and you palpate along the border of the jaw all the way to the jaw angle, which indicates the submandibular branches. Then you go up here in front of the ear, and that's the preauricular branches. Then you go behind the ear, and you're supposed to see these two, which would be your postauricular branches. And then you draw a imaginary line from the edge of the pinna all the way to the occiput, and you palpate along that border, and that would be your occipital lymph nodes. And then you come back, and then you palpate along the anterior border of the trapezius, which would be your posterior cervical chain, down there. And then along the anterior border of the sternocleidomastoid would be your last bit, which is your anterior cervical chain, and then seamlessly transition into the supraclavicular lymph node. This tutorial is to examine the sternocleidomastoid and locate the JVP. To initiate this, first we need to locate the manubrium, and we know that the origin and insertion starts from the mastoid process all the way. So these two heads are outlined there, you can see them. And in between that triangle is where you should be able to locate the JVP, only if it's distended. And the way you measure the JVP is you make the patient sit at a 45 degrees angle, and you turn the head to the left side. Then if you can see a JVP between the two heads of the sternocleidomastoid, you're supposed to locate it and say it was there. Then I would have to measure it all the way from here, from the edge of the manubrium, and what you're supposed to then calculate is how many centimeters it is. That would be 5 centimeters. And that's a way you calculate the JVP.